we have very few doctors. We disincentivize people from practicing medicine in this country. A lot of our best and brightest doctors emigrate. A lot of them go to North America because there's no market. There's nothing that helps them. And of course, the government for a long time would always say, well, we can just make this work a little bit more if we spend more. So the current government has almost increased by about 80% spending on healthcare. But of course, as long as you have a socialist system, no amount of extra spending is going to rescue it. And so there was an absolutely neat example of the unplanned consequences of socialism. The government decreed centrally that all general practitioners were going to get a big pay rise. Well, doctors are human beings. They understandably started working shorter hours. Yeah. So the effect of this massive injection of government cash wasn't just to be useless, it actually made it worse.
Those are the comments of the British member of European Parliament, Dan Hannan, not to be confused with the man who's interviewing him, Hannity, on Fox. Tony Benn, your response?
Well, I just don't recognize it as the health service that I know and use. I mean, the number of doctors has doubled, the waiting list is down to very little for people, and talk to anyone in Britain who's used the health service. I must say I have one suspicion. I don't believe that man has ever used the National Health Service. He uses private health insurance. Nobody who uses the health service, as all my family have done, have ever had a criticism of that character. And you see, I suppose it's really basically a question of, do you regard the health of the nation as a national interest? Now, in the United States, taxpayers pay for the education of children. Does that make it socialized education? The police are paid for by the taxpayers. Does that make it a socialized police force? The fire services are public services. Does that mean they are socialized fire services? You see, this is just the language of very, very rich people who don't want to make a contribution for the health care of others. I'm afraid it's the beginning and end of it, the whole argument. And the Member of Parliament you quoted has been denounced by his own leader. And Mrs. Thatcher said the health service is safe in our hands. And when she said that, and she was the most right-wing leader we've had in Britain for many years, when she said that about the health service, that gives you the clearest recommendation I can think of for a right-wing American audience.
Tony Benn, finally, any thoughts on the comparison of the debate you're seeing today with what happened before the National Health Service was ushered in Britain? Are you seeing an echo of it?
Yes, in a way. I mean, some of the doctors were opposed to it, but they all came round. Some of the consultants said we don't want to be civil servants, but they're not civil servants. You had a little bit of it, but I tell you what really changed it, and takes you back to the 1930s. We had mass unemployment, as you did in the United States, and I was a pilot in the Royal Air Force in the war, and we were discussing on a troop ship coming home once how we would deal with the problems of unemployment. And one lad got up and he said something I've never forgotten. He said, in the 1930s we had mass unemployment, but we don't have unemployment when we're killing Germans. He said, if you can have full employment by killing Germans, why can't you have full employment by building hospitals, building schools, recruiting teachers, recruiting nurses, recruiting doctors? And that's how we got it. We took the view that a government had a responsibility to focus on the needs of a nation in peacetime in the way in which it does in wartime. And if that principle's followed, then all the ideological language can be set aside. You've got to judge a country by whether its needs are met and not just by whether some people make a profit. I've never met Mr. Dow Jones, and I'm sure he works very, very hard with his averages. We get them every hour. But I don't think the happiness of a nation is decided by the share values in Wall Street.
Well, I want to thank you, Tony Benn, very much for being with us, former cabinet minister, longest-serving MP in the history of the Labour Party, also president of the Stop the War Coalition, speaking to us from London. As we wrap our British segment before we move on to Canada's healthcare system, by repeating that story that many Britons were surprised to read a recent editorial in the American newspaper Investor's Business Daily. The editorial stated, people such as scientist Stephen Hawking wouldn't have a chance in the UK, where the National Health Service would say the life of this brilliant man, because of his physical handicaps, is essentially worthless. Well, Hawking was in fact born in Britain and has lived there his whole life. The newspaper was forced to run a correction. Hawking said, "I wouldn't be here today if it were not for the NHS." That's the National Health Service of Britain. This is Democracy Now! When we come back from our break, we'll be in Toronto to look at Canada's healthcare system. Stay with us.